back to Great Day Medical Monday. Well, chiropractors can help treat pain on several parts of the body, but did you know they can also help your children grow and develop in the most natural way possible? From colic in the cradle to frozen shoulder on the football field, they can also help your child overcome or avoid injuries. Here to explain, please welcome back sports practitioner Dr. Tony Deramus with Sandstone Chiropractic and pediatric chiropractors Dr. Lindsey Thomas and Dr. Chantelle Kempenski. Good morning. I have to admit, I always thought that chiropractors are basically used for those folks that were getting older, but when you think about what kids are dealing with today, a lot of them play so many sports all year round, and then my son's backpack alone is just crazy.
Yeah, absolutely. And we've discussed that, chiropractic is beginning to mature now, and during that maturation process, we're seeing us specialize in certain areas. And when you look at the specialties in our profession, pediatrics is by far the largest growing. In fact, we have about 68 million, roughly, children that are being treated every year now, annually by the chiropractor.
All right, let's back up and talk about what chiropractic medicine is.
Sure.
So my favorite question is that I get from people is why are you adjusting kids? Why are you adjusting that baby? Yeah. And a lot of times they're like, how can they be in pain? They're so little. And what I tell people is typically we're not adjusting babies to get them out of pain, but we're adjusting them to help strengthen their nervous system to allow them to adapt to stress better.
Yeah, because a lot of it, when our bodies are out of that alignment, your body starts to try to compensate for certain things, and that's when you get kind of those kinks and things, and it makes you more prone to even injuries, doesn't it?
Yes.
It does. A lot of times when we adjust children athletes, what happens is we're able to go in and correct those postural imbalances, allowing the spine to absorb the forces at a better rate so that we can prevent injuries, and then if they do get injuries, they're able to recover at a faster rate as well.
And also, obviously, you have to be skilled in adjusting different bodies, and so this is where at Sandstone you guys are very cognizant of that, and people are trained in doing that. For example, doing a baby would be a little bit different than a 500-pound man, right? So what are the things that you're looking at when you adjust a baby? What do you look for? How do you tell by just looking at a baby there that something may be off?
Absolutely. We have various techniques in our office that we use. A lot of times people think that we'll go in and adjust a baby just like we do an adult with a manual adjustment, but we're going to base the adjustment based on their weight and age. So we may use our hands, but if we do, it's just going to be a very light pressure, sustained contact, or we have instruments in the office that we use that are very gentle, safe, and effective as well.
Yeah, and the things like we talked about, dealing with colic, for example, just that when stuff is in alignment, that it works like it's supposed to, can even address things like that.
Absolutely. It's really overall about reducing stress on the body. And so colic is one of those well-researched areas, and chiropractic has been shown very effective for children.
If I had only known.
Now
you all know. And the different tools that you guys use, that's part of the process as well.
Yes, it is, absolutely. And we have a couple of different instruments, one that's just a light impulse, one that does just gentle vibration along the spine, and we find that kids actually love it. It's really relaxing to them.
Yeah, and it can also impact sleep, which we also know that kids are not getting enough sleep today. So this is one of those things that can kind of just open up that pathway to get a good night's sleep?
Absolutely.
Yeah. What it basically is doing when we're doing the adjustment, it allows the nervous system to function like it's supposed to. So your nervous system controls everything in the body, so we're just increasing that efficiency so that their body can just relax and do what it's supposed to do.
Yeah,
okay, I'm going to take a deep breath and go.
Yeah, I'm bringing my son in because my son wakes up with headaches like I used to wake up with headaches.
Yeah.
And I say I used to wake up with headaches because a couple of months ago you were here and you said to me, oh, well, you started feeling along my back. You said that might be related to you're carrying a lot of stress right here. And to be honest with you, I was like, he's not going to just do an adjustment. My headaches are going away. Of course, I thought I was dying of something else. And you just went, you did that, gone. Haven't had a headache since. Haven't had a headache since.
Well, I mean, in general, as we discussed, that the 80 to 90% of headaches do come from the neck area. And granted, that's where we do hold a lot of our stress. So it was very easy when I was feeling your neck to say that's exactly where that's coming from.
The weight of the world is right here.
Not everyone has an immediate release like you did, but most people that come into our office, I mean, a very high success rate with even not just the acute headaches like yours were, but the chronic headaches as well.
Yeah, and because chiropractic medicine deals with the whole overall how the body's working with itself, is sleep issues, constipation, allergies.
Constipation is one of those things with children that happens pretty quickly sometimes. A baby's constipated for a week, comes in the office, and then before they leave the office,
they'll have a full diaper.
They'll have a full diaper.
Yeah, for sure.
Some extra diapers
if you
there.
want a belief system in chiropractic, watch that.
Yeah, ear aches, things like that as well.
Yes, ear infections. And one thing that we always tell parents is we're not fixing that symptom, but rather by adjusting their body, we're allowing their nervous system to function at a higher level so they can adapt to those things or get over those things a little quicker.
Yeah, and with that said, I want to round out with what chiropractic medicine is, because I think people have an idea. It's all over the map. We've seen chiropractors practice kind of something way over here, something way over here.
Sure.
Comprehensively, what is it meant to do?
Yeah, I'm glad you brought that up, because I feel like our profession, I said we're dividing into specialties now, but we're actually honing in on a philosophy of ours that the body can heal itself, that we just have to find what's interfering with that process. Now, we've always done that, with the spine and the nervous system, but now you see us actually looking into functional neurology, which is a way to look at the brain and actually treat the body, reconnect the body and the brain together. We're looking at functional medicine, and we're starting to bring all of that together to really allow the body to say, hey, do your job as it was meant to do, without drugs and surgery and those other things.
Yeah, before you reach for the prescription, go ahead and see how the body can help itself, because the body was truly made to help itself.
Yes, and what we're seeing now is we're removing more body parts and adding more drugs and more tests, but we're getting sicker and sicker as a society, so we need to figure out what to do about that, and the best way is to get back to what the body was designed to do in the first place.
All right.
Take a new approach.
Thank you very much. To learn more about pediatric chiropractic care, you can visit sandstonechiro.com, sandstonechiro.com, and look for the link under the Great Day Houston logo. You can also call 936-851-1631, 936-851-1631 for more information. And this seems like it just makes sense to me, because I would rather not put pills in my son's body if I could avoid that. All right. Well, is it your dream